So this is the last part of the fatigue and pain video, and here I'm going to talk mostly about what to do about pain, but I'm particularly going to point towards external resources that were not prepared by our department, and particularly YouTube videos and leaflets that you can make use of, you can start making use of, working on this issue of pain. So the first thing I'm going to talk about is this short video made by the Pain Service of New South Wales in Australia, which is to be found on YouTube, and it's actually an award-winning video. So go to YouTube, which is probably where you are now anyway, and in the search bar put Hunter Integrated Pain Service, and press enter or click the little magnifying glass, and this is going to come up, and the one that I'm particularly thinking about is this one here, which talks about what is chronic pain, but you will notice that there is other videos as well that you may be curious about to look into. So what about chronic pain? Chronic pain and the brain. The machinery of chronic pain in the brain seems to relate a lot to areas that have to do with emotion and evaluation. So we can say, first of all, that what's in the brain, the experience, the learning that you have accumulated in your brain, affects the experience of pain. So we find, for example, that people that have had abusive experiences in the past, and in particularly abusive childhood, may experience pain conditions in a worse manner than other individuals. And it works the other way around as well. So the experience of pain, the fact that your brain is encoding the experience of pain at any particular period of your life, means that your feelings and your thoughts and your expectations about the world can become negative. And this is not, so to speak, all in your mind. There is quite specific evidence from brain scanning about these changes in function. And I'm going to give you here a small example by Gundel and colleagues that was published a few years ago in this specialist journal. About a little bit about how important and complex these changes in function are when there is chronic pain. So these researchers took people that were healthy and people that were experiencing chronic pain without a major physical sort of organic damage accounting for the pain at that time. And what they found was that there was both areas of decreased activation in the brain of patients when they experienced a pinprick. So the brain of the people that suffered the chronic pain reacted less to the pinprick than that of healthy people. And these are the areas up here that are on the front of the brain in this area called the orbitofrontal cortex, that has a lot to do with evaluating situations and perceptions and stimuli. And at the same time, there were other areas in the brain of the patients that reacted more to the pain than the areas of the healthy people reacted to the pain of that pinprick. And you'll notice those areas here, and they involve this area here called the amygdala, in particular, which is related to this one here. This is actually mostly these areas are quite close together in the brain, but these are different views of the brain. And this area here called the insula, and these three areas have got, it is thought, a lot to do with the feelings that one experiences surrounding a sensation. So the brains of the healthy people overall reacted differently to those experiencing this unexplained chronic pain, and this was in a variety of areas in a complex pattern, in areas that have to do with emotions, evaluation, and possibly with decision making, with what you do about the pain. So I'll now move to the final bit, which is a bit of advice about pain management. So if you experience acute pain, basically you do what comes naturally. You look for a cause, you remove the pain, you rest, and do whatever the diagnosis involved means you have to do. However, with chronic pain, the first thing to say is don't. Don't put your goals on hold. Please carry on having goals for your life, and that involves a certain amount of accepting that for now this pain has gone on, it's unlikely to go away quickly. So you accept a certain degree of pain and you are aiming to improve it and to get to your goals and to increase your rewarding activities, despite the fact that you may still experience some pain. And again, this, like with fatigue, involves monitoring what's going on and planning with the aid of a diary. So grading, seeing how much you can do without making your pain worse the next day, and how to pace yourself, how to gradually structure and increase your activity so that you build up your resistance to the pain, and at the same time improve your life. Look after your fitness and your general health. Use pain-relieving medication in close cooperation with your doctor, and don't be afraid to reduce it. This is a complex issue of how to best use a pain-relieving medication, and in chronic pain it's very important that you work closely with your doctor, and the things that don't work you don't take more and more of. And I would say look after the thinking and feeling side of yourself too. Look out for the negative effect that your experience of pain can have on your outlook in life. So there is this other workbook, which again is available for you, that we can email you or you can download from the web, and it's called the Pain Toolkit. And you can actually, it's safe for you to make a start on working with your pain and rehabilitating with your pain. Although I understand that there's a lot of people that obviously feel concerned about that. So talk to us, and do take your first steps, read about it, and more intense work will be available during your inpatient treatment. So in terms of suggested homework, as always, SMART goals. You can now carry on with the full 5 areas diary. So not just how your symptoms interact with your situation and your behaviors, but by now you can actually use a more complex diary that involves your thoughts, your responses to the whole situation, your thoughts, your symptoms, and your behaviors, and the outcome, how maybe your responses have changed the way you feel, the way you think, and the way you behave. Depending on your needs, you can focus some of your goals on either fatigue or in pain, based on what we've talked about in this talk. And that's it. Thank you very much for your attention, and until next time.